Smugness and contempt. These are possibly the two best words to describe how the public health movement and the mainstream media treat vaping. There's no better example of this than a campaign launched just last week by the city of Pasadena in Southern California. Public health officials there unveiled a highly derisive anti-vaping campaign, one that calls vapers stupid. The ad campaign, which is taxpayer funded through the U.S. Centers for Disease Control, is supported by bus transit ads, point of sale, and social media. The campaign visually portrays vapers as sheep, and it barks, "Don't follow the herd. Vaping effects are unknown," and then it calls vapers stupid sheep. It's hard to imagine how public health officials could believe this campaign to be fair-minded or even acceptable for public consumption. Beyond blatantly insulting, the ad is misleading, as vaping effects are not unknown. As we have reported here numerous times, many scientists and medical officials believe vaping to be at least 95% safer than smoking. It's messages like these from public health that have created what tobacco control expert Clive Bates says is a widespread misperception of the risks of vaping. Here is Bates speaking with Dr. Sally Sattel on AEI's Viewpoint.
What is real about e-cigarettes and what they think. And roughly speaking, I think it's just over 5% of Americans would say e-cigarettes are much less harmful than cigarettes, which is the right answer and can only be that answer. 37% say the same or worse, and another 36% say, I don't know.
And that perception has been changing over the last few years in the direction of more ignorance.
In the wrong direction, which is amazing. So to me, I mean, this is why Public Health England, Royal College of Physicians have come out and been so clear about giving people an anchor, a quantified anchor, at least 95% lower risk.
So if more people now believe vaping is as harmful or even more harmful than smoking, who's to blame? Well, clearly the public health movement is a driving force, supported by an ecosystem which includes scientists churning out suspect studies and the mainstream media dutifully pumping out negative headlines. Media hysteria over vaping is relentless, and despite all the positive news over the past 16 months, it continues unabated. But there are mainstream media outlets daring to take a fresh look at vaping, and one of them is Canada's national broadcaster, the CBC.
I'm Mark Kelly. The Fifth Estate starts now.
The Fifth Estate is the CBC's flagship news magazine show, and while the network's been no friend of vaping in the past, this fall it shattered media orthodoxy, delivering a fair-minded account on the issues of vaping.
These laboratory lungs are the testing ground in a multi-billion-dollar battle to build a safer cigarette. The dirty truth of cigarettes revealed.
This is the residue that's left from the traditional tobacco cigarette. This is the residue that's left from the e-cigarette. Old cigarette, new cigarette.
Postmark Kelly, who also wrote the 40-minute episode, left little on the table in his exploration of vaping. He took the plunge, trying an e-cigarette for the first time at a vape expo in Toronto. He pressed public health officials in both Canada and the UK. He challenged the motives of big tobacco entering the industry, and he spoke with a heart surgeon and a soccer mom about the devastating impact of smoking and their belief that vaping saves lives.
So, doctor, here's what I don't understand.
Yeah.
How does a surgeon
Right.
end up in the business of owning and running a vape store?
Well, I've seen the harm that cigarette smoking has caused and the incredible difficulty people have had trying to get off. Even after heart surgery, many people can't get off cigarettes.
You think that vaping is the solution to get people off cigarettes?
For me, it's a solution that's been created by smokers for themselves because the medical paradigm has failed.
Smokers are people. They're members of our society. They're my patients. They're our family, friends, and neighbors. We just can't vilify them and say quit or die.
We quit smoking, right?
Yeah.
We've done a lot of things this year.
We have.
In 1 year.
And it was quite the year. Cancer killed Jen's husband. She knew she had to kick her habit and save herself.
And I took the smallest drag and I looked out my front window. And there were my kids, whose whose dad had just died from cancer. And there was their mom standing in the driveway. Using something that is known to cause cancer And I hated myself. I felt sick to my stomach. I couldn't believe that I was doing it to them, not just myself. And I said, never, ever, ever again. They'll kill you. Plain and simple, they will kill you.
Joining us today to talk about the impact the Fifth Estate piece is having on the public's perception of vaping in Canada is Frank Crothers. He and his wife Tina are the co-owners of Quitters, a highly successful vape shop in Stoney Creek, Ontario. Frank, thanks for joining us today. First off, what did you think of the Fifth Estate episode?
I really got to hand it to Mark Kelly. You know, he went in that CBE and he actually tried vaping. It was a zero nicotine, and he tried. Like, he was right, and he actually looked like he was interested in it, not just blah, blah, blah reporting. He was interested in it. And I think at the end, I was very pleased with the Fifth Estate report. It showed a lot of different angles on it. I absolutely, the surgeon that started out, the way they started the piece, going and seeing that a surgeon actually has his own vape shop, and he's helping people that way before he's got to cut them open. What a great way of starting a piece.
Frank, has the Fifth Estate piece helped combat some of the negative coverage in the press?
It absolutely helps, 100%. It shows it in the amount of new setups that we do. I mean, absolute new people that's never vaped before, increased probably almost twice as many in the last 3 weeks than previous weeks. In a 3-week period, it's probably been at least 40 or a little more of brand new people, where it could have been 20, 25 on a normal basis. And I asked them what brings them in and what had stopped them from coming, and it was the negative. And then they hear more of the positive.
Frank, when a smoker hears the negative reports in the press, and let's call them erroneous, how does that impact their thinking?
It's confusing. I compare it to a roller coaster ride, you know, you know, I know a little bit about addiction. And, you know, once you give somebody that little bit of an excuse, like a negative thing, then they just put their arms up in the air, and it's an excuse not to make the switch and just go back to the simpler, easy thing of just smoking.
So bottom line, Frank, do you think vapers should be happy with the Fifth Estate piece?
I think it showed the faces of true vapers. It really it hit on a lot of points, and I just wish that more people could see it, because you know, it wasn't a, you know, let's everybody vape. It shows that there is an option for people. And I think as Canadians, as adults, we should be able to make that choice.
Well, that's it for this edition of RegWatch. Before you head off, please like us on Facebook, and don't forget to follow us on Twitter. For RegulatorWatch.com, I'm Brent Stafford.